in this particular field of health management. And I mean, that is not an easy job because this is a very big country. And that you've done it is another feather in your cap. Another feather that I look at is this collaboration with Johns Hopkins. By the way, I'm sure all of you know that Johns Hopkins is one of the top institutes in the world today. And if it goes out of its way to create a collaboration, then the people that are collaborating with it must be very tops too. So I'm very pleased to hear that. That you're helped, that you've made great steps in doing something about polio, about leprosy, that you've been to Afghanistan, that you spent 10 years in Afghanistan at the most difficult period. Well, hats off, because a lot of people were running away at that time, not running towards it. So you went there, spent 10 years of your time, gave that kind of care to people who've been out of everything, is a huge feather in your cap, and again a very big congratulations to you all. By the way, an institution like this to become self-sustaining, I'm used to people coming to me and saying, grant, please. But here is one which has actually managed to keep its pride intact, which has managed to make an impact countrywide, and which has still managed to be self-sustaining, and which I think goes on to higher heights. And that, by the way, is a very, very big achievement. So, to be self-sustaining, to be known across the country, and to have made your mark in a very short period of time, because this, by the way, 19 years, 20 years is nothing. 25 years, 30 years is a drop in the ocean for an institution, and that you've done it in such a short period of time is also hugely commendable. And finally, the last commendation, and I'm sure it's not the last, because there's going to be lots and lots of more of commendations that will be added to this string. The fact that the degree awarded in this institution, awarded here, is recognized in the US. Now this is not a small thing. The fact that it's recognized in the US and vice versa, normally we recognize them. But the fact that they recognize us is not a small achievement, not a mean achievement at all. And so, hats off, you can't take it off just now, but hats off to you guys, you can't take it off just now. But hats off to you all for all this. I mean, your biodata is as long as my arm. So, at this very first visit to your institution, I have to congratulate you for all these firsts, and with this long list of commendations that you have, and basically congratulate this management for being able to put something together so fine, where the students are acceptable to everybody outside. Now you're just telling me that Gujarat grabs them all. So I suppose it must be a state that's in the forefront. And I guess it's something that we must follow. So, I'm in line, and I think it's something to have to look at. By the way, along with elementary education in this country, I believe healthcare is possibly one of the largest challenges that we're going to face. And there the matter of management becomes very important because doctors are very busy. And especially in understaffed and enormous institutions, it becomes extremely difficult for them to not only take care of their patients, but to actually make an effort to take care of management. And as I see it now, without management, a hospital cannot, in this day and age, run well. So here is a very, very important skill, and that I think that it is absolutely essential that professional training is awarded to you all, and that the quality of healthcare, which today is dubious, is actually strengthened by the fact that you people work alongside it. So in the last years, I think that you've managed to set this record, and you've managed to put a distinct discipline on its feet. For that you need to be congratulated, because I mean, this was, I'd say a few years ago, a discipline that was not much recognized. Today it is very recognized, and everybody, and I just had the opportunity of meeting the Manipal hospitals people that come over. And the first thing that they talked about was health sector management and how important it was. And a few days later, here I am at an institution that takes care of just this. So, congratulations, you're at the forefront of a pioneering setup. So, for me, it's a matter of pride because here in front of me is a microcosm of the states. I asked Mr. Mehta to just tell me who all and where all do all these students come from. So he said 19 states, amongst them Rajasthan. So when I see you all sitting in front of me, I'm actually saluting the nation because everybody is here. There's so many of you working in this field who will take Gujarat to Andhra and maybe Andhra to Rajasthan and Rajasthan to UP and UP to Bihar, and it just goes on, and this is cross-pollination. And with all of you setting standards at each of the hospitals that you take over, I believe that not only will you be raising the pride for your own state, but you'll be doing a service to all mankind and to all the people in that area. And now, thanks to you, people like All India Institute have suddenly woken up and understood how important this particular area is. Now, as far as Rajasthan is concerned, really, I do believe that it does not inspire too much confidence. In our previous years, we tried very much to upgrade infrastructure because I believe that was most important, particularly for referral hospitals and for teaching hospitals, and creating public-private partnerships, at least in the diagnostics field. And I remember when we were doing this, it was really difficult to break into the field because they said, well, you know, this is the way it's been for so many years. So when you start thinking out of the box and moving into an area that not many people have used to, you get lots of people standing in the way. But then at that time, if you lie back and allow them to walk over you, then you had it. At that very point, you've got to be able to stick to your guns, to understand that the principles that you set forward were done with a certain amount of reasoning. You don't back away, you do what you have to do, and that the result stands there before you. So it's very important that you don't step away. Tertiary care units, telemedicine, I remember when we brought it in 2003-04, people said these things don't work. But now, you see it around the country and definitely abroad, that tertiary care is very, very important and telemedicine is used by everyone. In those days it wasn't. Now I would say to you all that it's time for us all to learn from the past and to formulate a future course of action. To understand that thinking out of the box may be difficult, but when you set out, it isn't difficult at all. You just have to let yourself flow, go with the flow. As of 1st of January 2014, the Rajasthan Medical Council had 34,200 MBBS doctors registered with them. This actually registers to one doctor per 200 of the population. Not good enough. And I need to be able to increase the number of qualified doctors, and this is paramount. And I realize that lots of things have to go with it. The quality of education, the quality of healthcare that you will provide, plus the quality of salaries and perks that the doctors and the people going with them manage to get. Obviously, they will graduate or slowly gravitate towards the areas which gives them these very good opportunities. So we have to be able to provide that for them. But in this backdrop, we have increased MBBS seats in the government medical colleges to about 1,200. And we've also got 500 in the private medical colleges. So that's a step in the right direction. Now we are looking forward to some more medical colleges coming up under the Rajasthan University of Health Sciences in Jaipur. In fact, the state is now planning to establish something like 7 new government medical colleges and then graduate next to upgradation of some identified district hospitals. Because this has become very important. Somewhere along the line, we have to start thinking differently, Mehta sir, and all of you. And I think the time has come for all of you to give us ideas, to understand how this archaic setup of primary health center, the community health center and on to the district hospital and on to specialty and super specialty hospitals. How do you integrate these? And how is it possible for us to be able to bring that rural population that gets next to nothing from everyone over these last 60 years, how do we bring them in to this pale so that they too can partake of our prosperity? Because without them coming in, the state can't move forward. So it's very, very important for us to start thinking, is it public-private partnership? Is it maybe an internship that works this way? Is it maybe bringing those things together and creating a situation by bringing people to the hospitals? Is there another way of doing it? We have to think of all these things. And I'm open to ideas. Really, I would love to hear from you all. Really. If there's some good ideas, you must put them together. I really believe, and I am a firm believer in the fact that continuous learning is a tool, and you need to fine-tune your professional skills with this. It's important for us to establish linkages and tie-ups with renowned hospitals like you've done. And we need to do more of those. Not only national, but international repute. Can we do it? Can we have a new concept of healthcare delivery? This is a new thing that we're thinking of. How do we go about, and in fact we intend to bring this new concept of healthcare delivery to homes and neighborhoods. But this is still on the drawing board, and we need to be actually fine-tune this to bring it to that stage. We realize that we have a much bigger role to play in disease prevention and prophylaxis. This is one of my favorite subjects, and I can go on this one for many, many hours. Because I really think that before you get on the table and somebody cuts you up, somebody takes you for operation, why can't we talk about preventive health care? Why can't we organize exercise? Why can't we see to it that we eat okay? Is it important for us as very svelte creatures when we get married, and 3 years later we swelled up to enormous proportions, and until somebody takes us, puts us on the table and does a heart operation or whatever it is, we don't even think about diet. We don't even think about walking. We don't even think about exercise. So I am insisting that this is a new line, and we must pay attention to prevention. We must pay attention to prevention everywhere. There must be some kind of units that take care of this. So now we're looking at also access of patients to quality cancer care. There's another disease that is really ruining people's lives. And to this end, we're setting up a state-of-art cancer institute in the Rajasthan University of Health Sciences in Jaipur. Also, improve what we have in Bikaner to a large extent, because Bikaner is also known as a cancer center. And I'm setting up a small tertiary care for cancer in Jhalawar. And we're also looking at a focused program awareness against these lifestyle diseases, basically sustain our efforts in controlling water and vector-borne diseases. This is another area that we really need to work on. So in the future course, upgradation of laboratories, these NABL and all these, that's another area that we need to really look at. Given this very specialized nature of modern healthcare, I think that the time has come for us to infuse into our healthcare systems professional managers, and that's where you all come in now. And I think that this university, this institution is doing the human service by producing people who can go into this area. So at this 17th convocation, I need to congratulate each and every one of you who are graduating today. And I'll just make a quote from Nelson Mandela, who said, "Education is the most powerful weapon which you can use to change the world." The difference between us and them is that we are educated and they have not been given the chance. We need to give them the chance to bring them into this and open a whole new world to them. And this is something that we can all do in our own areas. And I expect that after this kind of privilege that you all have, you will be able to do it. So, when you step out of your college, when you step out of your home,